Hello, my name is Dr. Dewan S. Raja. Today I will discuss about basal ganglia, also called basal nuclei. These are the subcortical gray matter structures of telencephalon, diencephalon, and midbrain. Gray matter that indicates the cell body of the neuron and the neuroglia and blood vessels. And collection of neuron inside the central nervous system, we call it nuclei. Basal ganglia include the following structure: caudate nucleus, lentiform nucleus. Lentiform nucleus has two parts, globus pallidus and putamen. Amygdaloid nuclear complex, claustrum, caudate nucleus and lentiform nucleus together forms the corpus striatum. Caudate nucleus and putamen forms the neostriatum. Subthalamic nucleus and substantia nigra of the midbrain are considered as the components of basal ganglia. There is no universal agreement about the components of the basal ganglia, and it is appropriate to say basal nuclei because these are inside the central nervous system, but it is always interchanged like basal ganglia or basal nuclei. Functions of basal nuclei. What are the functions? Basal ganglia or nuclei are part of the extrapyramidal system. Basal ganglia are joined together and connects different parts of the nervous system and works as a consultant. Okay, it receives information from different part of the central nervous system and it modulate that information and send back the information to that area from where it receives the information. Regulates the voluntary motor activity without directly affecting the strength, sensation, or cerebellar function. The basal ganglia are involved in affective behaviors, in sensory motor integration, and in cognitive functions. So we are seeing part of the basal ganglia here. This is the horizontal section of the brain. We are looking here the lentiform nucleus. Lentiform nucleus has part like that of the globus pallidus and the putamen. Outside that we have the claustrum just underneath the insular cortex. Okay, so we got a good part of the basal ganglia in this horizontal section of the brain. Okay, so this is the caudate nucleus, this is the lentiform nucleus. Okay, we got that. Then this is the part of the midbrain and here is the substantia nigra. It is connected to the lentiform nucleus. Okay, so it carries the information to the basal ganglia, then it sends back again to that area or to the other area, and this is the motor and sensory areas of cerebral cortex, and the neurotransmitter is glutamate going to the corpus striatum. Okay, we have the interlaminar nucleothalamus that also work along with the basal ganglia, subthalamic nuclei, thalamus, globus pallidus, and the brain stem, then spinal cord here, and substantia nigra has some role here, gamma aminobutyric acid substance P, and acetylcholine that all are related to the corpus striatum and substantia nigra. Okay, so this is a diagram that shows the main functional connection of the basal nuclei, how they influence the muscle activity. Motor cerebral cortex, sensocerebral cortex, thalamus, brainstem, substantia nigra, that is a part of the midbrain, and red nucleus, that is also present in the brainstem. They put input on the caudate nucleus and putamen that goes to the globus pallidus. From there, they come back again to the motor cortex, sensory cortex. Okay, or from the motor cortex, we'll get something going to the cranial nerve, motor nuclei, anterior horn cells of the spinal cord. Okay, so this way it works. The main functional connection of the basal nuclei and how they influence the muscle activity. Okay, we got that. Okay, we got that. The cerebral cortex is connected to the subcortical gray matter like this, the caudate nucleus, the lentiform nucleus. Okay, these are the basal ganglia. We have to find out some extrapyramidal movement disorder. Our basal ganglia or basal nuclei are part of the extrapyramidal tract. Okay, so we have some extrapyramidal movement disorder like that of Parkinson's disease, our cytoplasm substantia nigra of the midbrain, substantia nigra compacta, and there will be depletion of a neurotransmitter called dopamine. Hemibolismus. Okay, people throw an object. Okay, and there will be jerking movement of the elbow and the shoulder. Hemibolismus, contralateral subthalamic nucleus. Huntington disease, we have Kodia, dancing movement, ethitosis, movement like that of worm, cytoblasm statal neuron in the caudate nucleus and putamen. Okay, we have one more here, that is Wilson disease or hepatolenticular degeneration. It is a disease of the copper male metabolism, but we have also the extrapyramidal movement disorder will get in a patient with Wilson disease. Copper will damage the person's brain. There will be necrosis and cavitation of the putamen, specifically putamen of the basal ganglia. So there will be cavity formation. And that's all about today's topics on the basal ganglia and its contribution in extrapyramidal system. We have also learned some of the abnormal body movement due to extrapyramidal defect, and basal ganglia is a part of the extrapyramidal system. And that's all for today. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice day. Bye now.